Charles Martin is here to join us this morning to talk to us about the ticking time bombs that baby boomers have. And okay, what is this one now? Because I know some of the time bombs. What's this one?
Well, just because you don't feel anything doesn't mean there's a problem. Unfortunately, the feelings that people had placed 20, 30, 40 years ago are breaking down.
They're wearing out.
They're wearing out.
They don't come with a guarantee?
Sorry. They corrode, they break down, and when they break down, they expand.
Okay.
When they expand, they break teeth. When they expand, they leak. And suddenly, I'm doing fine, and suddenly you're not.
Right.
So the proactive and the right thing to do is to make sure that your dentist checks you out very carefully with that and to do something about them if they have outworn their usefulness.
Okay. Why should a person spend the time and money and energy to get teeth back to optimum condition? I mean, they're working.
Right.
You know, why is that?
Well, it's really quite simple. If your teeth have gone downhill and you don't know it because you can't feel it, doesn't mean they're okay. But what are the advantages of getting fixed up? First of all, it's how you look.
They're going to look a lot better.
You're going to look a lot better. So,
does this include the people that have the old silver fillings and things like that? That you don't have to have that look anymore.
You don't have to have that look anymore. That's exactly right. So you're going to look better, and we know when you look better, people respond to you differently. You are perceived as a more friendly person. And actually, we have evidence to show that people get raises, anywhere from 4 to 14% as a result of looking better. And a smile is such a dominant part of our look. It's important for that reason. The other reason is because of your health. And we know when you have healthy teeth and gums, you'll have a better quality of life, you get less sick, and you live longer.
Yeah, I know when I go to the dentist nowadays, they do a much more thorough exam than they did years ago. I mean, they're looking at everything.
Right.
And years ago, you went in, you got your teeth cleaned, and you were gone. Now they do a full exam.
Right.
And that is because of your teeth actually affect your health.
Right. Well, what we now know is that having healthy teeth and gums help you to avoid having a special protein secreted in your body as a result of infections. And Bill, the thing is that 75% of the population have these infections. They're related to gum disease, and most people have them in some form or fashion. And so this special enzyme, actually it's a protein that's secreted called C-reactive protein, circulates through the bloodstream, can lodge in the heart, help cause coronary blockages, actually create strokes. So this is kind of
this is something you definitely want to have your dentist checked out.
Absolutely.
Okay. All right, we've got another before and after real quick, and we'll take a look at this one.
Yeah. This gentleman, very
huge
busy.
Difference.
Yeah, huge difference. Very busy in his life. Had a small business. He and his wife came up from a couple hours away, and he said, I know it's important to have a good-looking smile. I've wanted to have one. I didn't know where to go, and what can you do for me? And so you can see the difference we've made for him in the after picture, and I can tell you that it's made a real difference in his life and how he feels about himself, his overall health, and how he's doing. And we've seen him a couple of times since we completed this, and he smiles all the time.
Yeah, I was going to say, I bet he smiles a lot
now. He smiles all the time.
All right, thank you, Dr. Martin.